So we're thrilled to welcome Dr. Tisha Deen today. She's a licensed psychologist and leader in behavioral health integration, policy advocacy, and workforce development. She serves as the director of behavioral health integration in the primary care and population health service line at the University of Arkansas for Medical Sciences. Dr. Deen is past president of the Arkansas Psychological Association and currently serves as the association's Federal Advocacy Coordinator and Government Relations Chair. She has played a key role in legislative efforts to expand psychologists' scope of practice and protect psychological test data. And I hear that you get an awesome award too at APA in Denver. So congrats on that.
Thank you. Thank you very much. Yes, I'm honored. Um, honored to be the sixth Arcane that's in to have gotten that award. And every single one of those Arcanes before me were mentors and heroes of mine. So it's always amazing whenever you get to be, your name gets to be put next to the people that you've looked up to your entire career. So, as Christina has said, my name is Tisha Deen. I know everybody on the call, at least have worked with or familiar with or talked with each of you at some point. And today, I really wanted to just spend our lunch and learn hour giving you some updates on things that happened in the last legislative session that ended in April of this year, and also to talk a little bit about things that we're thinking about will be happening in the next legislative session, which, although seems far away in 2027, we know is not at all far away. And like I was saying at the beginning with Christina, I am happy to entertain questions and have conversations while I'm presenting this information. I would love to have a dialogue. I don't want to have this be a didactic. This is not incredibly new information, I think, to most of you. But I do think it's important to add look at things in context to make sure that our membership is aware of some of these changes so that we can all be involved in the next steps. Because passing a law is just one step in a process. So we have got a lot of work to do over the next year and a half, 2 years to make sure things are implemented in a way that is beneficial to our practice and to the people we work with. So I'm going to share my screen. So, like I said, some of the issues, and these are not all of the issues at all. I've got a little bit of a summary at the end, but some things that I wanted to kind of touch on today was the law passed to expand the use of neuropsychological technicians to all psychological assessment in Arkansas, to update the licensure requirements and scope of practice for master's level professionals. That was something that was passed this legislative session. Some efforts that we made to protect psychological testing data materials and some information about kind of how that we hit some little bumps along the way. So that's something we're still going to be working on going forward. And then some information around legislation for prescription privileges for psychologists, which was not something that was introduced as a bill this session, but was introduced in other ways, and is something that legislators are talking about for the next session. So it's kind of my summary. So just to kind of level set us all, I am not a neuropsychologist and I work in primary care, so I don't do a ton of testing anymore. I did a lot of testing in my training and absolutely love it and think it's so fun and neat to do. But as far as me keeping up with how things are going, I don't know as much. So this is kind of some background on our ideas and how we got to the idea and how we began to kind of think about expanding technicians for all psychological assessment. So in Arkansas, one of the things that we have found is there's a really high demand for psychological assessment services in general and long wait times for testing. most of you are very aware of this. I have participated for the last in between the last two legislative sessions, a legislative work group for behavioral health or for mental health in Arkansas with a coalition of people with lots of different agencies and legislators trying to think about what are some ways that we can improve mental health in Arkansas. And one of the big ones has always been we don't have enough testing. We don't have enough testing. There's long waits for kids who need assessments for learning disorders and autism spectrum and things like that, for Social Security, for disability, for different things like that. So that's always been something that I've heard from the legislative side and from different agencies. And so one of the things that we've wanted to do is try to come up with some solutions. Um, so, many psychologists, and we've done some surveys and asked psychologists about, do you take Medicaid for testing, and do you take Medicare, and do you do these kinds of testing? And we found that many don't offer due to low reimbursement rates and difficulties with bureaucracy, and that it's just really not worth their time to that it takes to invest in the materials and the time that it takes. So we wanted to work with our membership and with the state to increase capacity, decrease waiting times for essential services, reduce anxiety for families who are waiting for these kinds of services, and also to be more cost effective. So Medicaid did not pay for the use of technicians, even for neuropsychologists, which is a big barrier for kids on Medicaid. Um, so there's a lot of issues around that. So it kind of prompted us to be like, what can we do? So some of the solutions that had been floated around were expand testing for two different other mental health professionals. So expand for LPCs and expand for LCSWs and expand to other types of professionals so that there's more people out there to do testing. Other ideas were to be lower standards, and some of the issues around culpability and capacity for assessment. Some of the state had floated the idea of having kind of a triage system where, oh, we know this person does and they shouldn't have to have all this testing, so we'll just put them in this pot, and then if we think it's a little bit more, then we'll give them testing. So, those are some ideas that I had heard being floated around, and that was concerning to me for a lot of reasons. One is, we want people to get, testing from people who have really high levels of training and understand what the limitations of our tools are, to understand and have the training to administer them and to interpret them in ways that are helpful. And then also, if you're talking about from a forensic standpoint, it's, these are very important answers to questions that we don't necessarily want lay people or people who have a vested interest in whether or not people, you know, get get testing or not to be making those decisions. We want everyone to get the same types of opportunities to be evaluated for their competence to stand trial and their culpability for their actions. You may have any thoughts, questions about kind of how we got to this moment in time? Does that sound accurate? Is there any things that you feel like I've left out or that might be inaccurate? Not hearing. Okay. I'm open to being inaccurate, so please let me know. Um, so a little bit of background on technicians. So as of 2024, 22 states allowed psychologists to employ technicians. So not just neuropsychologists, but all psychologists. 12 states had specific testing technician laws. Arkansas was the only state that limited technicians to neuropsychology only. And Arkansas also had a requirements for a bachelor's degree in a psychology or related field, and also these four required courses, which also no other state required these four specific required courses. And one of the issues that we have had for years is neuropsychologists having difficulty hiring technicians because they had not had one or more of these courses, and then that people couldn't get those courses in a timely manner. So this another kind of barrier to having access to technicians. So in 2025, the legislative session, a law was passed to change the title from neuropsychological technician to psychological technician. That they have the scope of practice to administer and score objective psychological and neuropsychological tests. They have to have a bachelor's degree as approved by the board. So it doesn't necessarily have to be a psychology bachelor's degree, but something that the board approves. Specified training. So instead of having the classes, they have to have 80 hours of training, including at least 4 hours of ethics, 16 hours studying, testing materials, 20 hours of direct observation, and 40 hours of supervised administration and scoring. And it's the supervising psychologist who is in charge of making sure that training is happening and has to kind of sign off on that. There's a limit to four full-time technicians per psychologist, so it's more of an FTE than a human, because in some of our places people share people, and so you could get into the thing where you have four people, but you actually only have like a tenth of four people. So we wanted to help expand it, but then also there was some concerns from Medicaid and other areas about if you just let people have as many as they wanted, that there could be difficulty in making sure that everything is happening in a way that's still ethical and good quality. So that was a compromise and an idea that helped the legislation pass. And then also it included language for technician services to be reimbursed by Medicaid. So any questions about that? So that did pass. And next steps for this legislation is the psychology board will have to draft rules that are approved by the governor's office, and then there will be a public comment period. Medicaid will have to create policies and procedures related to payment. One of the things that I want to do is to create a work group and make sure that, especially psychologists who will be very impacted by this, who want to use technicians, are involved in the that rulemaking process and are able to voice. One of the things that is a limitation of me being involved in many of these things is that I don't have firsthand knowledge. I don't use technicians. I don't do a lot of testing. I don't work with kids. And so I really rely on our membership and everybody to put in their information about what are the things that you're experiencing, what are the issues, what are the things that we want to make sure get put into the rules. So that's the next steps in that. All right. So next, I'm going to move. Go
Can I
ahead,
add?
Sabine.
My concern was that I think I love that. That's a good step. But from my, I don't know if this is helpful, but my concern is that this will not improve the testing rate of people and children on Medicaid at all. I mean, I'm a tester. That's what I do. That's what I love to do. I did autism evaluations, and I had to stop doing it just because Medicaid does not reimburse. And that would be the same if I have a technician, because I think I mean, Medicaid has very strict guidelines what testing you can do in general. And for an autism assessment, I think they reimburse 3 hours. You're not allowed to do a diagnostic interview, and you're not allowed to get any time to do report. You don't get any time for report writing or for feedback session. I just cannot do an autism evaluation in 3 hours. I just can't. And so I do once a month pro bono. But other than that, I can't. And there's no other provider in the state who does other than the Dentist Developmental Center, who now has a wait time for 2 years, and they triage, and they don't take anybody over 12 and all that. So I would say in the state of Arkansas, autism testing is in an absolute crisis. Um, I work at Pediatrics Plus, and they just do the testing for free for the kids to get enrolled in their ABA program. Yeah,
Yeah.
because that is where they ought to create revenue, and they think, okay, we just throw the diagnostic process in to it also serves the kids. But I feel like for that problem, the testing technician or even allowing LPEs to do more testing, this is not going to make a difference unless something happens with these reimbursement rates and the limitations to do testing per se. You know, you can only do it when the kid is in therapy, and there are so many stipulations that make it nearly impossible. So now I don't want this to be like a downer or anything on all your efforts, but I'm really, really concerned. I see these poor kids and these families, and they're waiting and waiting and waiting, and I
And
feel,
so, what we really need from my perspective is for, to get to hear your voice, right? Like I talk
yeah.
to legislators and they ask me, what do we need to do? But I'm not in that space,
Mm-hmm.
right? And so, whenever I ask, I need this information. And I've talked to Representative Johnson, and he's really interested in working with us and working with
Yeah.
Medicaid on
Well,
improving reimbursement rates.
I'm certainly not the one who sits at that. You know, I'm not going through the Medicaid guidelines and handbooks, and they change every year. Up until a year ago, we could still do it, but now with the
Yeah,
new situation, we can't anymore. But I mean, I would be willing to help. I would get the information from our clinic director who
mhm,
does all the billing and who has then decided not to take Medicaid for testing. I mean, we do take Medicaid clients for therapy. That's not a problem. It is
yeah.
really the testing. And so, yeah, I'd be happy to provide that info. I maybe did not do a good job in reading all my emails.
Oh, I don't know if any of us do a good job at reading all our emails. Yeah, no, this is great. This is why I'm doing this. I want to hear, and as we go through this process, like they're going to open up the Medicaid regulations, and part of that is, talking about their reimbursement for testing, but or for LP, blah, 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 for psychological, uh, what's technicians,
Examine.
there's the word I'm looking for. But that can also include talking about like the whole process. Again, like we don't know what's actually going to happen, but if we're not there expressing what is the barrier, then
Yeah, I
it's certainly
agree.
not going to happen.
I absolutely agree.
Yeah. Thank you. It's helpful. So I'm going to briefly talk about the change in the laws around master's level practice of psychology in Arkansas. So, part of the background that I find kind of fascinating, I actually found the act today, the original 1955 act that established the Arkansas Psychology Board, and it originally created two levels of psychology practice, the licensed psychological examiner and the psychologist. So Arkansas has, since it's had regulated practice psychology, has had LPEs and psychologists. Um, and it's a really interesting read. It kind of talks a little bit about like not stepping on the medical practice. Like we have to talk to psychiatry if we're doing medical kinds of things, and just kind of an interesting read to think about like the history of psychology. It's also really interesting to me that the ARPA our start date is 1945. So there's been an Arkansas Psychological Association before there was a license for psychology in the state, or at least the psychology board. So I don't know. To me, that's pretty fascinating, interesting to think about the background. In 2007, Act 505 was passed, which created a pathway to independence for LPE. So created the LPEI and then sunsetted the LPE in 2013. So from 2013 to 2023, there were no new LPE licenses. And again, everybody correct me if I say these things wrong. 2023, there was the Act 573, which reestablished the master's level psychology licensure. And again, going back to my first conversation, the first thing we talked about, one of the reasons behind that was the concerns about the need for testing in the state of Arkansas. And so this was something that was legislator driven to say we need more mental health professionals. The psychology community has limited this, and so we want to bring it back. And so, and as from ARPA's standpoint, we talked to legislators and asked to think about, like, how can we update that licensure? How can we bring it in to where in line with what APA was been thinking? And the compromise that they did was they passed Act 573, and Act 573 sunsetted the LPE licensure again in 2024. With the understanding that in 2025 there would be more legislation that would be creating a for lack of a better word, I say like an updated, modernized require or licensure for the master's level practice of psychology. So I think a lot of our membership and psychologists I don't know if they're not aware or, but they don't understand like how this has moved over the last, 50 years or 70 years. And also, the idea that, the law that was passed this last session was, something that was a compromise, not, I won't say compromise, it was a coalitional agreement between the state of Arkansas that said we need more we're going to have more mental health professionals, and we're going to do it regardless of what anybody says. This is something that's going to happen. And the psychologists and the LPEs coming together and finding legislation that would that everybody was I don't that everyone could live with. I'm sure the LPs did not get everything that they wanted, and there were some psychologists that were concerned about. They thought that in 2013 this was all settled, or yeah, but this was something that's been we that was a group effort. So. More background that 20 states, as this is of 2024, this might be a little bit outdated. There may be a few more, there's not any less. States that allow independent master's level psychology practice, and with varying levels of or types of titles. And the titles, the scope, the requirements vary from state to state. And then in 2024, the ASPPB and APA started working together to develop new licensure guidelines for the title and scope of practice, in hopes to, well, at least as as they were saying, in hopes to create a more uniform structure for the master's level practice of psychology across the states, have it be less variable on what people are called and what kinds of requirements for licensure there are. Um, and So that's something that started in 2024. As we've already said before, Arkansas has always, since we had a psychology board, we've had master's level practice. We've had LPIs practicing successfully and competently since 2007. Some of the research that Art has done has shown there's no differences between licenses and board complaints or discipline. Um, and Arkansas is a psychology poor state, right? We do not have a lot of psychologists. And people trained in our field and the discipline and the theories of psychology. So another thing to think about is, there are many, many more other behavioral health and mental health professionals than there are people in our psychology profession. So about 850 psychology licensees versus 4,000 social work licenses, 3,500 LPC licenses. As I talked about with the licensing or the testing before, there's very, very strong push to expand those licenses for doing things that psychologists or church psychology professionals, LPEs, and psychologists have been. That's traditionally been their training, their scope, and their expertise. And then, if we all know that cost, time, and access are significant barriers to doctoral training. And so, one of the things that in psychology we've wanted to do always, since I've been a trainee more longer ago than I care to think about, is our idea that we really want to diversify our profession. We want to be welcoming and bring in people from all walks of life as psychologists, so that we can learn and grow together. We know from our training in psychology that whenever we have a diverse group of people working together, we are stronger. We have more viewpoints, and we are able to do more. So, the goal for the session, Act 433 that was passed, was to update the LPE statute to be more consistent with the APA and ASPP guidelines, created the licensed psychological practitioner, and also a provisional licensure status while under the post-degree supervision. Updated the education requirements to include 60-degree hours in clinical counseling or school psychology. So a 60-hour degree, APA or NESP accreditation equivalents, 800 hours of supervised practicum. And then it updated the post-degree requirements to a 3,000 hour post-degree supervision with 2,200 hours of direct clinical supervision. So this is equivalent to the LPC requirements in the state, with 1 hour a week per 1 hour per week of supervision by a psychologist, and up to half of the supervision can be from an LPP with appropriate training, 100 hours a year of didactic training. So really putting some more structure to that post-degree requirements, which there's not as much structure now. And then really putting in the scope of practice. So there was some debate and some pushback from the legislature to be so specific in the requirements. A lot of times laws are written in as vague terms as possible, and then they are created in the rules and regulations process. But as we really wanted to spell things out just so that we could have things be in the law and not as open to interpretation based on who was in the executive branch. So, for example, our board this year did presented to the governor's office some of these requirements to try to put into our rules and regulations, and the governor's office rejected them, saying that wasn't part of the scope of the changes that they were wanting them to make. So if you put it in the law, it's much harder for things to be changed depending on what who's in the executive branch, because they're who's in charge of the rules and regulations and who's on the board too. So, evidence-based therapeutic interventions, diagnosis, treatment, and management of mental and emotional disorders, psychological screening, interviewing, testing. Um, and you guys have these slides, so I don't want to read all this to you. I think the biggest things are the exclusions, advanced testing, consultation requiring doctoral level training like neuropsychology, and forensic testings. And this is consistent. The 2023 law added the forensic assessments in, so this kind of moved that in there. Scope must be based on verified coursework, supervised training, and supervision, attested of competence and approved by the psychology board. So if you're just like now, and with us as psychologists, if I'm practicing, I've got to prove that I've been trained in that, and supervisor attesting of competence. And so, again, I think this allows people to get their training, get their supervision in the things that they're interested in and want to do, and then they can attest that that's part of their scope. Because, one of the things with master's level is just there's just not enough as much time to get the broad training or the deep training in so many different things. But it doesn't mean that you can't get really good deep training in several things or a couple of things and then have that be part of your scope of practice. So that was the thinking behind that. And then if you want to add any area to your scope of practice, documenting graduate coursework, approved supervised experience, and evaluation of readiness for the entry level practice. So, adding super adding scope of practice means you have to add some training. Questions or discussion around that? Yeah, it's good to see my stickers. So this is also a common question that we've had is, okay, well, what happens to our LPEs now, right? Like, um, so basically what this creates is a multi-tiered profession. So we've got the licensed psychologist, the LPP, the L anyone who is currently an LPI would be grandfathered into becoming an LPP. Um, and and that's just the independent master's level practice of psychology. All master's level licensees in the future will be LPPs. Um, so they will have to go through those requirements we talked about before to become an LPP. Current LPEs, so these are master's level LPEs who are not independent practice. So right now, they will continue to practice as they have, with verified coursework, supervised training, supervision, and tested of competence like they do now. But the LPE designation will be sunsetted, and there will not be new LPEs that are not independent practice. Um, so and LPEs can convert to LPIs. Um, so does that make sense? There's a lot. There's a lot of LPs and EIs and IEs and EEs, but so at some point there will, at some point there will be psychologists and LPPs. And those will be the two practices in psychology. And then you'll have provisionally licensed psychologists and provisionally licensed LPPs who are both, getting their training to get into their to be fully licensed. So just like the other legislation we talked about, the psychology board has to draft rules that are approved by the governor's office after a public comment period. Medicaid will have to create policies and procedures related to payment. In the law, we did put that they would be reimbursed like LPEIs and LPPs are reimbursed now. Creation of a work group to oversee this process. I'd really love to have input from all LPPs, LPEs, LPEIs, psychologists to help us to keep an eye on this process and make sure that there isn't something that gets put in or things aren't written in a way that is not the way we intended in the law or the way that if there's unintended or intended consequences that we don't want. Um, Training programs. We don't have any master's level training programs in Arkansas. So there will not be this, and this is what something we've talked to legislators about. Like, there's not going to be a flood of master's level psychologists in the state because we don't have any training programs. But I've heard rumors that there may be some interest, but we all know those are months and years long processes. Um, and then also continuing to be involved with and monitor APA's role. So APA has an accreditation now, and being involved in that process too. There's a lot of change happening, and we have a say in how that process goes as far as what how the profession of psychology defines um, scope and training and all of that. There's a lot of places where we can insert our opinions. So I encourage people to do that. So discussion questions about that. No, that's a lot. Should be a lot of change happening in the next few years. And also, I think with change always comes potential and promise. So I'm hoping that, we can all come together and make sure that this is a positive change for psychology and the practice, and also for the people of Arkansas, and in being able to get access to good quality support. So briefly, very briefly, I want to talk a little bit about the data protection. So this is another uh, issue that was brought forth by psychologists who were uh, members who wanted to propose legislation around protecting data in testing materials. Um, you know, we face challenges in protecting testing materials. So a lot of the materials that we use are copyrighted. They are the specific questions and the scoring is really important to keep out of public hands, because then it compromises the testing integrity. It it compromises our ability to do our job, really. And so in Arkansas and a lot of states lack laws to protect psychological test data. There's kind of a our ethics tell us don't give it out unless you have to by law, and the law says, if we can make you give it to us. So there's not a lot of defined pieces in there that really help to protect psychologists whenever they don't want to give out testing data. So our tests are involved in high stakes decisions, child custody, litigation, risk assessments, protecting that information ensures fairness. And there are some recent court cases, especially in California, that really highlight that protection, the need for protection. And yeah,
When you say testing data, now, at first I thought you were talking about just the tests per se, but you mean administer tests with scoring and identify people that have been tested. Or what
I'm
do you
sorry.
mean? Do you
I
mean the
mean,
tests?
the tests.
So not what any specific client data or anything.
No, I don't mean
Okay.
like reports and like
Okay. Okay.
interpretations, but
Okay.
the actual testing material. So
The
there
blank,
are,
the
yeah,
blank protocols and the blank testing materials. Okay.
yeah. So, now we have provisions. What we say ethically is we can give it to another person who can interpret it, but we're not just going to give the raw test data to the client or to a lawyer, without them having another person who's there to interpret it. But there was some legislation, or not legislation, there was a lawsuit in California where the judge had made them give all the materials to the other lawyers. And there's concerns across the nation around, like, for disability determinations, and for other types of testing that people can be coached based on the testing materials, if that information is leaked and given to different groups of people. So we did uh, work really hard and we had legislation that was filed. We had a great champion in Representative Hudson. Unfortunately, we hit some snags, and there were some specific organizations in Arkansas that um, were pretty adamant against the legislation and did not want us to have this in statute. So we really wanted to, we took a step back, and we want to really kind of uh, gather our forces and really think through, like, building a coalition and understand, helping to educate legislators and educate the public around what the intent of the legislation is, and try again next session. So part of what we want to do is engage APA, address objections from professionals, examine the third party observations. So there's some concerns around, like, third party observations, so who can be in the room, who cannot be in the room, those kinds of things. Differentiating between the clinical and forensic cases, and HIPAA considerations. Collaborate with the legal experts, conduct stakeholder meetings, and then advocating for the adoption. One of the interesting things that you will find is that as you get into kind of this world, um, there's a lot of details and a lot of pieces and the way things are written is very, very, very important. And so things can seem very simple when we propose them, and it makes a very good sense. But then once you kind of get everybody's fingers in it, it can get real complicated real quickly. So this is not something that we're dropping, but it is something that we tabled for this session. And the last thing I just wanted to bring up is that there was some interest from two legislators, Representative Johnson and Representative Grimlich, around the prescription privileges for psychologists. Again, this is to them an access situation where there's not enough psychologists in Arkansas. There's certainly enough psychiatrists in Arkansas. And so not well, he is Dr. Representative Johnson is he's a ER physician. He's also been a real advocate and champion for with us for psychology, and so something that he was really interested in. They did not consult with us before filing these interim study proposals. And the interim study proposals are really legislation that, for the most part, psychologists don't support. It's really kind of creating a relationship with a psychiatrist and like not practicing necessarily independently. So while we were grateful for them wanting to support, you know, psychologists and wanting to expand access. We really wanted to kind of take a minute and think about like if legislation were to be filed and passed, we wanted it to be legislation that was something that psychologists really wanted. There was obviously some pushback and uh, 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 dismay from some of the medical communities. I learned about it because the I don't know if he's the lobbyist. Maybe the lobbyist for the medical board called me to ask me about it. Um, so I was like, "Oh, hold on a minute. Let me read about this because I nobody told me they were filing this legislation." Um, so I say all that to say that there's likely going to be legislation filed in 2027, whether psychologists want it or not. And so we really want to build a coalition to ensure that whatever is presented and passed, if passed, is in line with what psychologists want and need. We've done polls in the recent past, and as far as the people, we know how this goes, but the people who responded to the polls, um, in as far as psychologists were concerned, it was about half and half of psychologists who were interested and thought that prescription privileges would be a good idea versus half of were more on the neutral slash bad idea. So, we are divided on this as psychologists. But I do think it's an important thing to keep on our radar and to be working for legislation in 2027. Um, the last thing that I think we want is for legislation to be filed and someone other than us be pushing for it and there be a big hoorah rah about it, us lose credibility with our friends and colleagues, and it be something passed that we don't even want. Um, so, and the way that our legislature works right now is that if a pretty strong group of representatives are interested in something, there's not a lot of ways to stop things. Especially if like the governor would decide this is something that she wants to champion, and it's hard to know what she might or might not champion. So, I just think it's important to we want to be on the train and not trying to stop the train. Is the way I look at it. Any, I know that's a very complex situation, but questions about that?
I mean, there are certain states, I think, Louisiana, where that's possible. So, what are the experiences there? I mean, I, for example, wouldn't have an opinion. I don't know any pros or cons, or except that I think, yes, it would be good not to have to wait 6 months to find a psychiatrist for a client you're treating.
Yeah, yeah, and that's one of the things I want us to be working on in the next year and a half, year is to really because it's changed a whole lot. I think three or four states have passed this legislation just in the last year or so. So there's a lot of momentum and there's a lot of things happening. Louisiana was, I think, one of the first states,
Yeah.
and they're actually not too happy about their
No?
legislation. Um, so it's one of those things that I feel like that we as in Arkansas need to, really do our homework, think about like what's happened, what's the research that we have, like what if it were to happen, what do we want? So I completely agree with you. And again, I'm one of those too, where it's like I don't think this is something I would ever want to do, and I don't have a real strong opinion about it, but I also, want us to be at the table and if we have a group of psychologists who really are for this and want it, we want to be support for them. All right, I know we're winding down. These are just a few of the issues that we also kind of that were brought up or that were interesting. There was a bill to create a preceptor tax incentive. Dr. Representative Johnson filed that. We actually asked to be added to that, and he graciously agreed. So you could get a tax incentive for basically being an internship supervisor, an intern supervisor. But it didn't pass. But that was something that might come up next session. We talked about the testing protection. There was some legislation that we had opposed, or at least I let our group know about that you could oppose around have it getting doing away with racial and gender qualifications of different boards. There was a religious freedom discrimination bill just around uh, not allowing people to do what they wanted to do based on their religion, which could open things up for discrimination. So with psychologists, we usually uh, we don't opt out of doing things because it's against our religion, but we treat people regardless of who they are. Um, the access bill, which is the higher education bill, had some really great things in it, but also had language that limited academic freedom, also limited government participation for students. They watered it down a tiny bit, but it's still not really great for students to be able to participate in protests and not be, you know, punished for not being at school. Some other things we were neutral on. Representative Clowney passed a bill to allow ABA practice to be governed by the psychology board. So it's going to create a registry for applied behavior analysts that they can opt into. It doesn't require them to be licensed or registered in the state of Arkansas, but if they are registered, then it gives patients and people the ability to have a governing body to talk to in Arkansas. So, and I have a list that you can click on. All right. So, in our last minute and a half to 2 minutes, what can you do? You can join my committee and have fun with us. I promise I will only ask you to do what you want to do, which is, help me understand what's going on in your world and, you know, help me to talk to people in a smart way. So I'm not telling legislators and people in the community or people that are talking to me, I'm not telling them the wrong information. If you want to testify, I will come and hold your hand and we will make it as easy as possible. If you don't ever want to do that, then you don't have to do that. You can help us write letters and we will never ever associate your name with it if you don't want your name on it. So lots of opportunities to be involved as out there as you want to be or as behind the scenes and no one even I've had people who aren't even listed on my committee who help me because they don't want to be listed as part of being on the committee for various reasons. So you can be involved without anybody ever knowing. Then joining our psychology pack, there'll be more information about this, but Chance McDermott has taken over. Bob Doyle, after years and years and years and years of service, has given over the reins to Chance, and so we will be really working on revamping our PAC, which is the Political Action Committee, which can actually provide support and give money to representatives. And then ARPA has the ability for you to donate to support our lobbyists who make all of this possible. And that is all I have.
Yeah, Tisha, we did have one question from Dr. Doyle.
Oh,
So he said, how did the graduate programs in the state respond to this change in licensure?
and hi, Bob. So I don't have any official no knowledge about like who like what's going to happen, but I have heard from some people that I know in a couple of, or at least one of the schools in the state that they are looking into creating a master's level um, program in psychology. So at least there's one group that's interested, and I think I don't. Yeah, I mean, I think we'll just have to see how it grows
Yeah.
and what we hear from APA.
This is Lauren Quetch at the University
Hi,
of
Lauren.
Arkansas. Hi. We are talking about it right now, so I know that our clinical faculty, we've drafted a few sort of guidelines and starting the process of having those conversations and seeing through the university how we might be able to get like a master's program started. So I don't know how long this will take. I mean, there are other organizations that are already doing it, but it is a conversation we're having.
Great.
And I know
Yes, it was.
UCA is revamping too. Yeah.
Well, I appreciate everyone for being here. And you can always reach out to me if you have questions or want to continue this conversation. This is something that I really enjoy talking about, and so I'm happy to do it.